Hello everyone, my name is Aurélie Brunie. I am the Deputy Director for Research for the Research for Scalable Solutions project at FHI 360. I'm delighted to speak with you about my WomenLift Health project today. There is surprisingly little data on gender inequity in career progression among global health researchers. Yet we know it is there globally and in Africa, and it is increasingly being denounced. There is a leaky pipeline in global health. Women across the world tend to be underrepresented in research, both as researchers and research participants. Overall, gender inequality in Africa remains high, and there are some data points and a reckoning in some settings in Africa around this issue, as you can see with this article on probes into gender imbalances in academia in South Africa. Thinking about my own experience, I have spent most of the past 15 years conducting research on health services in Africa. The intended beneficiaries of this work have largely been women, but the senior African researchers that I have partnered with have disproportionately been men. So the question that I wanted to ask myself, my organization, and this larger community is this: what can we do about this within the context of global research partnership structures? I started to think about this through a career stage lens with a two-pronged strategy. The first prong targets graduate students with the idea of a research fellowship program. The second prong targets career researchers with the idea of a participatory assessment to produce recommendations on what we can do to address gender inequity within the context of global research partnership structures. Progress has been slower on the second prong, so I'll speak to the first prong today. This idea has solidified into plans for a research fellowship program between Makerere University School of Public Health in Uganda and FHI 360. As many of you know, Makerere University is a prominent African institution, but there are also personal considerations that go into this partnership. And one of them is that the Dean of the School of Public Health, Professor Rhoda Wanyenze, is a gender champion. She is the first female dean of the School of Public Health in 65 years, and she is one of 3 women among 29 deans at the university. When she started her tenure, she chaired a committee on gender equity that gave a presentation to the parliament, which led to gender imbalances being noted as a concern. And this is one of the factors that's helping us target the fellowship program to female graduate students. For the pilot year, we are aiming to support 2 fellows. The fellows will work an average of 20 hours per week remotely through a calendar year, and they will be embedded within research teams at FHI 360, where they will gain hands-on experience with global health research projects. At FHI 360, research is embedded within a research utilization framework. And one thing that strikes me as I reflect upon my journey over the past year is the alignment between the phases of this framework, which are the arrows here, the building blocks of the WomenLift Health program at the bottom, and the evolution of this project. And so I'll share one experience that's been defining for me at each of the 3 phases. For the foundational phase and throughout, it's the affirmation of the power of internal and external alliances to iterate the initial concept and pushing forward. This is not an individual project. At the second stage, it's making the business case, meaning articulating the idea within the context of my organization's mission, priorities, and values, and that of global trends such as diversity, equity, and inclusions, and decolonization and equity in global health and development. For the third stage, which we are very much still in, it's a comment by an organizational manager that it was time to transition the idea into organizational structures. This brings new experiences around institutionalization and further strategizing around sustainability. For me, the leadership journey comes on top of a transition from 15 years as a principal investigator to deputy director for research on a global project. As a researcher, I am motivated to generate evidence that can improve the lives of women. But the leadership journey has helped me think about how I can use this transition to explore new ways to bolster women by instilling change within my organization and my field. The picture on the right is the epitome of this evolution. It was taken in 2018 when we were collaborating on a study on the hormonal IUD. Kate Rademacher on the right joined the inaugural cohort of the US leadership journey, and she encouraged me to apply. Namwinga Chintu, next to Kate, became Africa Partnership Director for WomenLift Health. In just over 3 years, the three of us went from conducting research to benefit women to also seeking ways to support and advance women in our field through WomenLift Health. Thank you for your attention today. I hope that this challenge resonates with you and that you are already thinking about what you can do to bolster the next generation of African female researchers in global health. And thank you very much to the WomenLift Health team and to my cohort for a wonderful year of inspiration and support.